We've now looked at economic stability and income in later life, and we've examined how federal health insurance impacts access to care. We complete Module 7 by exploring the diverse range of programs that directly support older adults' quality of life, beyond medical care and Social Security income. While Social Security and Medicare form the economic and medical backbone for many older adults, quality of life depends on programs that support daily living needs, social engagement, mobility and independence, nutrition and food security, housing stability, and caregiver support. These programs exist at federal, state, and local levels, and together they form an ecosystem of supports essential for aging well. Importantly, how they work and how well they are funded and coordinated affects people's ability to remain healthy, independent, and engaged in their communities. We'll begin with a discussion on one of the most important pieces of aging policy in U.S. history. The Older Americans Act, or the OAA, was passed in 1965, around the same time that Medicare and Medicaid were established. The OAA was designed to fund community-based services that support independence and quality of life for older adults. It recognizes that aging well requires more than clinics and insurance. It requires supportive services embedded in communities. The OAA funds services such as congregate meals at senior centers, home-delivered meals like Meals on Wheels programs, transportation services, caregiver support and respite services, legal assistance, elder abuse prevention and ombudsman programs, and case management and care planning. These are not fringe services. They are often the programs that prevent isolation, malnutrition, and unnecessary institutionalization. The OAA is administered federally through the Administration for Community Living, or the ACL, and then distributed to states and local area agencies on aging, or AAAs, that tailor services to local populations. Despite its importance, the Older American Act's funding has not kept pace with the nation's growing aging population. The act is supposed to be reauthorized regularly by Congress, but this has not been the case. There have been instances where Congress has failed to pass a long-term reauthorization and instead opted for a short-term spending package, and other instances where they failed to pass anything, and the state of the OAA left in limbo. This occurred in the first year of President Trump's second term. This matters because OAA funding is flat or stagnant in many areas. Demand for services is rising with the aging of the baby boom cohort. Local AAAs struggle with limited dollars for ever-expanding wait lists, and states must often try to supplement federal funds to meet local needs. In practice, this precarious funding means that programs like home-delivered meals may have long wait lists, transportation services may be limited, and caregiver respite support may be minimal. Understanding the political and fiscal context of the OAA is therefore not just an academic exercise. It's essential for administrators who rely on these funds to operate services on the ground. Federal infrastructure like the OAA forms the backbone for promoting the lives and well-being of older adults in the U.S., but community-based supports come in many forms, often funded or coordinated locally. As an example, senior centers offer social and recreational activities, wellness classes, educational programming, and peer support and connection. These senior centers tend to be a local hub for social engagement. And as we've seen in this course, social engagement is itself a protective factor for health, reducing isolation and improving mental well-being. Another common community-based support comes in the form of adult day programs, which can provide structured daytime support, socialization, health monitoring, and respite for caregivers. These are especially valuable for older adults with cognitive impairment or functional needs that do not require full institutional care. Local options may also be available for home health and personal care assistance. For older adults who want to remain in their homes, services may include skilled nursing visits, personal care assistance with things like bathing and dressing, homemaker services, and medication reminders. These services may be funded through Medicaid or subsidized programs and can allow people to remain at home longer. Community supports also encompass transportation, which can affect independence in profound ways. It can impact one's access to medical appointments, one's ability to go grocery shopping, and one's ability to socialize and engage with the community at large. Local programs you may have even seen in your community include OAA funded transportation, paratransit services, volunteer driver programs, and ride sharing partnerships. We'll devote a separate section to housing support in this lecture due to its complexity and importance. Stable, affordable housing is a core determinant of quality of life in aging. Several federal programs exist which support housing for older adults, including HUD Section 202, or Supportive Housing for the Elderly, which provides affordable housing with supportive services. Housing Choice Vouchers, which provide rental subsidies that many older adults use to afford market rate housing, and public housing units designated for older adults. At the state and local level, assisted living facilities and congregate housing options can provide social opportunities, on-site services, and supportive environments, particularly for those in need of assistance with activities of daily living. It should be noted, though, that these programs vary widely in quality, regulation, and cost. Now, while assisted or congregate living may be a suitable option for some, many prefer to age in place and remain at home. There are thus some local programs that may offer home modification assistance, such as building ramps or grab bars when needed, weatherization support, and property tax relief programs. Such services help older adults remain safely at home. We'll also devote a small section here to nutrition, as food security is fundamental to health. One of the best-known programs supporting food security is the Supplemental Nutrition Assistance Program, or SNAP. SNAP is a federal program that provides food purchasing assistance. Yet, older adults are among the least likely to access full SNAP benefits, often due to stigma or lack of awareness. Beyond SNAP, the OAA also funds congregate meals, nutritious meals in social settings, and home-delivered meals, particularly for homebound older adults. This is all important because adequate nutrition contributes to medication effectiveness, immune function, strength and mobility, and cognitive health. Okay, so we did already cover transportation earlier in this lecture, but there's more to say on the topic. Transportation programs extend independence beyond clinical visits. As an example, Medicaid's non-emergency medical transportation pays for rides to appointments for eligible individuals. Many communities support volunteer driver programs or paratransit services for people with mobility limitations. And rideshare partnerships expand options, though accessibility barriers remain. While we may view transportation as a luxury, it's actually a key determinant of health, social participation, and safety. Family caregivers provide the bulk of long-term support for older adults, often at great personal cost. The National Family Caregiver Support Program, funded under the OAA, offers respite care, counseling and support groups, training on caregiving tasks, and care coordination, among other things. These services reduce caregiver burden, delay institutionalization, and support family systems. However, caregiver supports are often underfunded and may vary significantly by location. Despite the rich ecosystem of programs, coordination remains a persistent challenge. Older adults and their families often navigate multiple eligibility systems at the federal, state, and local levels, which can be confusing. In addition, there are sometimes complex application processes, redundant assessments, and fragmented funding streams. This fragmentation is not just inconvenient, it can result in service gaps, duplication, and increased cost. To this end, effective coordination requires shared data systems, interagency collaboration, case management, and cross-sector partnerships. Easier said than done. Policymakers and administrators increasingly look to models like accountable communities for health or integrated care networks to align health and social services. Programs do not work equally for everyone. Disparities in access can arise from geography, where rural areas often have less transportation and fewer service providers, race and ethnicity, where structural barriers limit access to housing, nutrition programs, and caregivers, language and culture, where non English speakers or culturally distinct communities may not see their needs reflected in standard service models, and the digital divide, where online application systems may disadvantage older adults without internet access or digital literacy. Addressing equity requires intentional design, culturally responsive services, and targeted outreach. For healthcare administrators and gerontology professionals, understanding this ecosystem enables better referral pathways, more effective community partnerships, thoughtful program design that reflects older adults' expressed needs, innovation to fill gaps in services like transportation, caregiver respite, or housing support, and evaluation of impact on independence, dignity, and quality of life. Ultimately, quality of life is not a side effect of health policy. It is a goal in itself. To summarize, older adults' quality of life depends on a wide range of programs, many of which are funded through the Older Americans Act, state initiatives, and local service networks. These programs support nutrition and food security, transportation and mobility, housing stability, social engagement, and caregiver support. Yet, challenges remain, especially in funding stability, coordination, and equitable access. As you reflect on this material, consider this question. If you were tasked with redesigning services in your community, where would you focus first to improve older adults' quality of life? And why? This concludes the third and final lecture for Module 7. If you have any questions about the material covered in this lecture, please contact your instructor for this course. Thanks for watching. You can pass it.